The following is a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions and get an inside look at the latest in healthcare, technology, and treatments. This is Rex on Call. Welcome to Rex on Call live on WRAL. I'm Sharon Delaney for UNC Rex Healthcare. Today we're talking about diabetes and cardiovascular disease. If you're watching us live and you have questions, they could be answered by our experts. The physicians taking your questions today are Dr. Dorian DeFreitas from Rex Vascular Specialists and Dr. Rachel Hollyfield from Rex Family Practice of Wakefield. To call us here at Rex on Call, just dial the number on your screen, 919-744-3876. If you're watching us as we stream live on WRAL.com, you can email us your questions, rexoncall@rexhealth.com, or find us on Twitter and send us a message at RexHealthcare, #RexOnCall. November is National Diabetes Month, giving us an opportunity to draw attention to the disease and its effects on millions of Americans. Statistics show a strong correlation between diabetes and cardiovascular disease. According to the American Heart Association, adults with diabetes are 2 to 4 times more likely to have cardiovascular disease or a stroke than adults without diabetes. Diabetes also can accelerate carotid artery disease. And people with diabetes often have high cholesterol and high blood pressure, which are major risk factors for cardiovascular disease. However, diabetes can be treated and managed to help delay the development of heart and blood vessel disease. And we're fortunate to live in an area with incredible physicians and healthcare options to address these needs. Under construction right now is the new North Carolina Heart and Vascular Hospital, located next to UNC Rex Hospital in Raleigh. We recently took a tour of this state-of-the-art facility. Welcome to what's quickly shaping up to become the North Carolina Heart and Vascular Hospital. This 8-story, 373,000 square foot building will consolidate UNC Rex's heart and vascular services into one location. Every aspect of the facility has been designed with patient care and comfort as a top priority, using best practices and input from patients, physicians, and caregivers. The hospital will have 114 private rooms, a cardiovascular intensive care unit, and specially adapted beds near the procedure floor to minimize patient travel. It will also feature amenities like a cafe, a sacred space, and family courtyard.
When you usually walk into a hospital, everything seems to be concise and cramped. Here we're priding ourselves on opening up, getting wider hallways, getting the nursing station, open that up to allow to kind of feel free. It helps them to feel better because they don't feel like they're cramped, they don't feel like they're in a hospital bed.
In addition, there will be a learning institute to assist physicians in providing education programs for patients, the community, and in-house training. The North Carolina Heart and Vascular Hospital is scheduled to open in early 2017. In the meantime, all the resources you would need to address cardiovascular health are already available at UNC Rex. Joining us now are Dr. Dorian DeFreitas and Dr. Hollyfield. Thanks so much for being here.
You're welcome.
I'd like to start with Dr. DeFreitas. At this new Heart and Vascular Hospital, there's going to be a hybrid vascular procedure suite. that's going to allow you to do a lot more possibly than what you're able to do now. Is that correct?
Yeah, absolutely. The new hybrid room is really a great leap forward for vascular care for patients coming to Rex in Wake County and surrounding. It really combines two elements. It's an operating room and what we call an endovascular suite, which allows us to deploy balloons and stents to open up blocked arteries. And in the old days, we used to have to take patients one day and place a balloon or a stent, and the next day do the operation. Now we can do everything all in one. And really, we have some of this capacity now at Rex, but in the new Heart and Vascular Institute, we're really going to have some fantastic technology where we're going to be able to do an on-table CT scan, create a roadmap of the entire vascular bed, then fuse those images and use them in real time to place balloons or stents in difficult-to-get-to arteries. That's going to be a win-win for both patients and for the physician to reduce the amount of time in the operating room, the amount of contrast dose, and also, as well as the radiation used. So it's really a big win.
A real game changer.
Yeah, absolutely.
All right, thank you. Dr. Hollyfield, in your practice, let's talk about how prevalent diabetes really is.
That's a good question. I would say probably on my average day I see anywhere from 1/3 to 1/2 of my patients have diabetes, and usually type 2 diabetes.
Okay, and if you could, let's talk about the differences between type 1 and type 2 diabetes.
So type 1 diabetes is usually that kind that you're going to be finding on early on in life, something that's pretty much genetic, you're born with it, and it's found early on. And that's where your pancreas just doesn't work at all and doesn't give out any insulin.
It's not necessarily a lifestyle-induced problem?
Exactly, it's not. Whereas type 2 diabetes we traditionally think of as being more lifestyle-induced. But the more studies coming out are showing that it's more than just being overweight or having a lot of extra fat tissue on your body. There's also environmental factors, very strong genetic factors, along with even ethnicity factors that come into play with developing type 2 diabetes and being at risk for it.
Okay. Dr. DeFreitas, can you expand the correlation between diabetes and cardiovascular disease?
Yeah, absolutely. If you look at the studies, almost 1/3 of patients with diabetes have some form of peripheral vascular disease, which I specialize in treating. And unfortunately for the diabetic, the diabetes directly affects the arterial wall, which leads to a cascade of events that builds up plaque within the artery. And it's actually a unique form of plaque buildup that's not seen in, let's say, your average smoker. And often can be very, very difficult and below in the small vessels in the leg. But there's a lot of, and when we see the patients, when they present to us with vascular disease, they usually come in a few forms. Often it's claudication, where a patient has difficulty walking, where they can only walk a few feet and they have to stop because of pain. Sometimes people develop a more severe form, which is called rest pain, where anytime they have their legs elevated, they get a burning pain on the top of their feet and they have to stand up and they can't sleep at night. And sometimes you get an even more severe form, which we're talking about threatened for limb loss, things like gangrene and so on, as well as carotid disease that puts the patient at risk of stroke.
And a lot of this has that association with
Absolutely.
diabetes.
Yeah, absolutely.
Okay. Dr. Holyfield, what are some of the warning signs that possibly you might be pre-diabetic?
So some things that we often see in patients who present with being pre-diabetic and not having full-blown diabetes, they usually have central obesity. So that means they're carrying a lot of weight in their abdomen and around their waist, not so much their hips. We also find that they show some signs of insulin resistance, which can be like a kind of a dark velvety rash around their neck or around their armpits. And so
these are symptoms that not even that is beyond blood work.
Yes.
Actual physical symptoms.
So you have patients come in and you see these signs on them and we need to start looking at this now.
Wow. Any other signs that they might be pre-diabetic?
Well, often patients who have a family history we can find them being pre-diabetic a lot sooner than waiting for them to have, the diagnosis later on in life. So knowing your family history is really important to know what you might be at risk for.
Would the intervention for a pre-diabetic patient be immediate lifestyle changes?
Absolutely. We know that, again, it's not just being overweight that can cause type 2 diabetes, but we know that having that extra fat tissue on your body really makes the cycle worse for the development of type 2 diabetes.
Okay. We have a question from Raleigh. Our caller wants to know, how do I know if I have carotid disease?
Really, most people that have carotid disease have no idea. In reality, what you need to do is have a screening carotid ultrasound, and people that are high risk, especially diabetics, smokers, people with high cholesterol or family history, are good people to potentially screen for with a carotid duplex. And often people will also identify it after they've had a stroke in their workup.
All right, so this is almost something you'll find out after the fact.
Exactly.
Okay, all right. Well, as we go to break, here are some common signs and symptoms of type 1 diabetes. Needing to urinate a lot, feeling very thirsty, feeling hungry all the time, feeling tired, blurred vision, losing weight suddenly without trying, nausea and vomiting. You should see your doctor if you are experiencing any of these. We're coming right back after the break to answer your questions. Give us a call or send us an email. Welcome back. This is Rex on Call live on WRAL, and today we're answering your questions on diabetes and cardiovascular health. If you have questions for our experts, call in now, 919-744-3876. Let's take some of those questions now. We have someone from Raleigh who wants to know, I'm a 60-year-old male. I have diabetes, vascular disease, and severe leg pain in both legs. He's going to have surgery on his legs in December, but he also has a pacemaker. Is it too late to become healthy? And is vascular disease curable?
I mean, it's never too late to become healthy. I mean, there's a lot of studies that have shown that if you can modify your risk factors, things like making sure your diabetes is under control, that your blood pressure is under control, and that your cholesterol is under control, you can reduce your risk of having a cardiovascular event, being a heart attack or stroke, by 50% over the long run. So it's never too late. Unfortunately, there's no defined cure for vascular disease. You can do things to help it. You can do bypasses and interventions to improve your symptoms. There's no cure, but there's still a lot of hope.
A lot of hope. Okay, thanks very much on that. Another caller, diabetes runs in my family. I'm not diabetic, but my legs swell throughout the day. Could it be a sign of diabetes or vascular disease? Is this a symptom that you might see, Dr. Hollyfield?
We do see that a lot in our patients, complaining of swelling in the legs. That kind of comes more towards at the end of the day, and then they find in the morning when they wake up it's not as bad. It's not always a sign of peripheral vascular disease or necessarily diabetes. For me, I usually see it a lot in my overweight patients who've been on their feet most of the day or pretty sedentary, and then it's just some extra swelling they get from the veins not really pumping the fluid back quite like they should.
That leads me to this next question, which also kind of rings true with this. Can diabetics also have varicose veins, and that swelling, is that somehow related, or are varicose veins completely different?
Yeah, varicose veins are completely different, but and it's seen in diabetics as well, but not related.
Okay, not related. All right, because sometimes with varicose veins there can also be swelling.
Exactly.
But it's not the same thing.
Yeah, it's usually directly from the varicose veins.
Okay, all right. Do stress levels have an impact on high sugar levels? This is from Doug in Durham.
Yes, absolutely. We know that when the body is in a state of stress, different hormones and things are being released that causes our blood sugar levels to be a little bit higher. So stress in general, if you can find a way to manage it, especially with exercise, is healthy not just for your stress levels, but also for your heart and your blood sugars and diabetes if you have it.
Okay. What should, Helen would like to know from Fayetteville, what should she be concerned of if she has a leaking valve and she's diabetic?
It really depends on where her leaking valve is, and it could be her heart, and she would need to talk to her cardiologist. There's valves within the legs and so on that we deal with as a vascular surgeon that could be venous related. So it really depends on exactly where it is.
Okay, so she should be followed up with,
Exactly.
with her physician.
Yeah.
Okay. Dr. Hollyfield, you say that you cannot just treat the patient, you have to treat the lifestyle. Let's drive that home a little bit more.
Yeah, so when it comes to someone who's a newly diagnosed diabetic, it's a multifactorial approach. It's not just a matter of giving them a prescription to lower their blood sugar and sending them out. We really have to address their whole lifestyle and really improve that. It's their diet, it's their exercise, and if those can improve, then we can really expand their lifespan and have them live a longer, healthier life than if we don't do any of those things. You can't do it with just medicine alone.
Because if there's not compliance, they will maybe end up in your office, Dr. DeFreitas, right?
Unfortunately, that's true, and even with the best care, they have, they can still end up seeing me. But that doesn't mean that we can't create a team for them. Sometimes people just need an additional support mechanism, and sometimes it's a vascular surgeon working in conjunction with a podiatrist, working with their primary care physician, working with their endocrinologist. You know, the patients need to know that it's a multi-system disease, and they need a whole host of specialists to help them really achieve that maximal health.
And you were used to having that collaborative approach,
Yeah,
aren't
absolutely,
you?
and that's a big point of the Heart and Vascular Center, that often I work in conjunction with their cardiologists. I know them directly, so if they have a vascular surgical problem and a heart problem, we can work together. Again, with the primary care doctors, I know a lot of them personally, so you can have a team of people that know each other, understand the care that's necessary for the patient.
Okay, all right. Well, coming up, we will answer more of your questions. Give us a call at 919-744-3876. Email us your questions at rexoncall@rexhealth.com. And as we go to break, here are some common signs and symptoms of type 2 diabetes. They are similar to type 1 diabetes, with feeling thirsty, very hungry and tired, blurred vision. And in addition to those signs, many people experience frequent infections or slow healing cuts and sores, and tingling, pain, or numbness in their hands or feet. Again, talk to your doctor if you are having any of these symptoms. Welcome back to Rex on Call here live on WRAL. To reach us, just give us a call at 919-744-3876 or email us your questions at rexoncall@rexhealth.com. With people living longer lives, more senior citizens depend on health care individually geared toward their special needs. UNC Rex partners with a center that helps meet those needs called Alignment Healthcare.
I do my own cooking and everything, so I can maneuver in the kitchen and so forth.
But Gary Green's independence was threatened because of health issues. Mr. Green has been living with diabetes for 30 years, which has left him with limited sensation in his legs.
Last year this time, I couldn't put my socks on, and I knew I needed help. And I couldn't lace my shoes, I couldn't button my shirt.
But Mr. Green's health has improved. He underwent spinal surgery, rehab, and is getting the care he needs here at the Alignment Healthcare Center, one of 4 in Wake County. The center recently managed Mr. Green's diabetic ulcer.
We saw Mr. Green every day for a couple months, literally every day in our clinic. We cleaned the wound every day, we dressed it every day. This is 5 days a week. We were able to make a difference, and he still has his foot today.
Alignment Healthcare Centers are designed to provide health care for seniors with complex medical illnesses, offering a more hands-on approach. A key component, providing patients who need them with take-home tools and then monitoring them every day by video.
They take home the tablet, which is the main device, and then they have a scale, which is important for our congestive heart failure patients. We want to monitor their weight daily. Blood pressure, so we're monitoring that daily. And then this, which is a pulse ox, and it monitors their oxygen levels and how fast their heart is beating. All this connects wirelessly to the device, so they don't have to plug anything in.
Keeping in contact with the patients, but also Alignment physicians, nurses, and other providers coordinate care for patients with a team of physicians and specialists across the UNC Rex healthcare system. Alignment nurse practitioner Jancy Webb.
Some of the care that he receives in our center, like the wound care, we want to make sure that his providers of the VA knows what we're doing.
So I can talk to Janice about my foot, which I get wounds on my feet, and she would contact my podiatrist. And I've been in his office when the two of them are talking.
Alignment Healthcare, catering to the needs of seniors to keep them at home, independent, and out of hospitals. A true believer, Mr. Green is now spreading the word to his friends and neighbors.
So I would say to any senior citizen, try it, and you'll love it.
There are several perks that Alignment Healthcare offers its patients, including free transportation, 0 copays for some medications, eyeglasses that are covered, and dental cleanings. Alignment Healthcare has locations around the Triangle in Wake Forest, Garner, Raleigh, and Cary. And Dr. Hollyfield, Mr. Green had problems with his feet, and that's something that you often suggest at patients who do have diabetes. What is their thing that you have to do with feet?
So every time a diabetic patient comes into the office to see their primary care doctor, they should just automatically take off their shoes and socks. Let the doctor see their feet so they can look at them, because they do tend to lose sensation and feeling and may not know it and could have a wound there that is getting worse. And so I also tell my patients, diabetics, check your feet every night before you go to bed. Make sure you don't see anything that's developing any kind of ulcer or lesion.
And if you see something, it needs to be addressed immediately,
Absolutely,
right? Because
right
it
away.
can escalate pretty quickly.
It can, especially if they can't feel it. By the time they notice it, it can be very far gone and they might have to lose part of their foot.
Okay. Dr. DeFreitas, what are some of the ways that you help patients avoid tissue loss or even amputation?
Yeah, absolutely. The first thing when I see a patient in consultation is to really assess their vascular status. If they have a wound, do they have enough blood supply to heal that wound without needing an operation? Can we treat them conservatively? And then we assess their risk factors. Are they a smoker? Can we stop them from smoking? Can we alter their blood pressure, cholesterol, or glucose control? Then the second thing that we look at is really if they need some form of intervention to improve their circulation, what is going to be the best treatment for them? Do they need a balloon or a stent to help them? Are they going to be someone that really needs a bypass? And I think at Rex Healthcare, we really offer kind of world-class service. I think that the treatment that you get is on par with what you get at Hopkins or any of the big name centers across the U.S. We also offer clinical trials that are really cutting-edge treatments for peripheral arterial disease. And so I think, the sad part of it is there's a nine-fold variation in the U.S. between amputation rates and diabetics, and you really need to know that you're getting the optimal care if you're in that situation.
And the thing is, just because you end up at an office like yours with a vascular surgeon does not mean you're going to lose a limb or anything like that.
Absolutely.
There are so many things you can do before that.
Absolutely, yeah. We can offer many, many things to help you through this hard part of your life.
Okay, all right. We will have a final round of questions after the break. This is Rex on Call. Welcome back to the show. This is Rex on Call, and we're taking a final round of your questions right now. Mary from Wendell wants to know, she had a scan performed on her neck and discovered a 60% blockage. What kind of action should she take?
And really at that point, there's no option for surgery or need for surgery or any kind of intervention. Really, the most important thing for her to know is that she needs to control all her medical risk factors. She needs to, if she's a smoker, needs to stop smoking, control her cholesterol, control her blood sugars, and make sure her blood pressure is under control. This is a real opportunity for her now that we know that she has vascular disease to change her course and get to a healthier lifestyle.
Okay, so it's not even a surgical intervention. It
Absolutely.
is change your lifestyle.
Yep.
Okay. All right, what causes your legs to feel hot or burning when you're diabetic? This is from Sadie in Carborough. Dr. Hollyfield?
So this could be from having diabetes for a very long time and having nerve damage from those high levels of blood sugar in their system. And so when the nerves are damaged like that, we often see the glove and stocking distribution of this kind of symptoms called the peripheral neuropathy. And so it's probably from having just a long history of diabetes and potentially uncontrolled diabetes.
Is there anything you can do about it to make it stop?
I mean, I think that the primary thing that you need to do is to really control your blood sugar. I mean, that's probably step number one. If it really bothers you, if it's really symptomatic, there are medications that you can use to kind of dull the nerves, really.
Okay. All right. George from Pikeville would like to know, he's currently taking medications for type 2 diabetes, but has been experiencing a lot of nausea. Is there a medication maybe he could change to that could help lessen those symptoms?
A lot of the medications we use for type 2 diabetes have that side effect of nausea. But oftentimes there's a couple that can come in formulations where the side effect's not as bad, or maybe taking them at night. It won't be as bad, but he really needs to talk to his doctor about his options if that's a problem he's having.
Okay. One caller from Raleigh says, how do you lose that belly fat? That's really a tough place to lose weight, as you age especially, isn't it?
It is, and it is tough to lose weight the older we get. It's not as easy as when we were in our 20s. But it's really meeting with your doctor and coming up with the right plan for diet and exercise. You got to have both in there. And sometimes it's necessary to meet with a nutritionist to help get you on track.
Okay. One other quick question here as we wrap up the show. How do you find a clinical trial for diabetes or heart and vascular disease?
I mean, usually if you're coming at least into a vascular surgeon's office, we would introduce you to whatever trials are available and would best suit your needs. As far as the medical side of things,
Usually it's going to come from seeing like an endocrinologist who might be performing those studies. Sometimes some primary care physicians are also involved in it, so it really depends on who your primary care physician is and what they're involved in.
So they can ask their doctors.
Yes.
All right. Well, thank you so much. And as always, consult with your physician about any health concerns. And if you are looking for a doctor beyond today's show, or you need a direct referral, you can call Rex HealthNet. That's Rex's free telephone information service. The number is 919-784-4490. Thank you to our phone bank for their calls today, and also thank you to our physicians for answering your questions. And join us next month for Rex on Call on December 14th. Our topic will be healthy eating. We'll see you next time.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.